Okay, these last few slides are to wrap up chapter 12 when we looked at types of cancer. I ended the other day with this slide, so if you already have this in your notes, then you can fast forward this video to the next. But if you don't, you want to make sure to get this down. So when we look at all the different types of cancer, they fall into one of four main categories. The first category, and the most common, is called carcinomas, and this is epithelial tissues that are impacted by cancer cells. So there's mutations in these cells and they become impacted. Sarcomas are usually the middle layer of tissue, the mesodermal layer, and so some examples would be bones, muscle, and general connective tissues in the body. So whenever you hear sarcoma, that's what you're dealing with. Lymphomas are cancers that develop in the lymphatic system or have possibly moved to the lymphatic system. And lastly is leukemias, and anytime that we talk about a leukemia type of cancer, this is special because it is cancer in the blood forming parts of the body. There are questions about knowing the difference between these four types of cancer in the unit test, so just make sure to put a little note here to review these. The book gives this picture, and it is the leading sites of new cancer cases and deaths by the 2013 estimates. So you can see here male versus female and the total number of new cases on the one side versus the estimated deaths on the other side. And you can see leading both sides for male and female is lung cancer for deaths, and that's what we talked about in class. However, new cases, prostate is in the lead for men and breast cancer for women, and then second for both is lung. Next we have colon and rectal cancer, and this is the third most common cancer in men and women. And risk factors, the number one risk factor is older age. Other issues, obesity, a family history, and any type of like ulcerative colitis, and even possibly Crohn's, where you have an inflammation of the colon and digestive system. Some warning signals could be bloody stool, rectal bleeding. Those could be some issues. Screening tests include a colonoscopy and then barium enemas. And treatment would generally be, well, first you would probably look at surgery, depending on where it's at and how far along. And then also, again, depending on where it's at, would be radiation. And then with regular exercise, a lot of like your antioxidant type of diet, high fiber diet, keeping a healthy weight, and then reducing or just keeping it at a very moderate level your alcohol intake seem to be some protective things that you can do to prevent this disease. Next we have pancreatic cancer. This is one of the deadlier cancers out there, and we're seeing a rise in numbers. Most patients die within 1 year from the date of their diagnosis, and we only have about a 6% survival rate. Remember, the survival rates are usually looking at 5-year survival rates. So within 5 years of their diagnosis, only 6% are alive. The number one risk factor appears to be the use of tobacco products, particularly smoking cigarettes, along with obesity, and then a diet that has high levels of red meat and high fat. One of the reasons it is so deadly is because it's really hard to catch in the early stages, mainly because there's really not a lot of symptoms, and also because there is a very poor screening for this. So by the time there are symptoms and by the time it is checked, it is usually so far advanced that it's hard to treat. Next we have prostate cancer. This is the most frequently diagnosed cancer in American men. We looked at that chart and we saw that. And it is the second leading cause of cancer deaths in men after lung cancer. Symptoms include any urinary issues. So if there's a weak or interrupted urine flow, sometimes they call that dribbling. It's just not coming out a normal, like with a normal flow, difficulty starting or stopping urination, urge to urinate frequently, blood in the urine, pain in the back or the pelvis or the thighs, anywhere along there, and many men do not have symptoms in the early stages. Now, if you remember back to the anatomy of this area, the urethra has to go through the prostate from the bladder is on top of the prostate, so the urethra is actually going through the prostate, and that's why we have the urinary problems, because it's basically blocking, almost pinching the urethra shut or causing problems there. So that's why we have these urinary issues. Risk factors, one of the big ones is age. So again, this is a disease that usually impacts older males, 50s or 60s. Race and also family history, and obviously your diet, making sure that you eat lots of fruit and vegetables can help lower the risk really of any cancer, but they see in studies that this impacts the rates of prostate cancer. The last two that the book covers, they don't give a lot of information in the book about either of these, but they do have a video about cervical cancer. I had posted that up on Edpuzzle. So we have cervical and endometrial or uterine cancer. And regular Pap tests are crucial for the cervical cancer, although that really wouldn't let you know about the uterine cancer. Risk, early onset of intercourse, so the younger that you are, that you start to have sex, that puts you at a higher risk. Obviously more partners, although that is not listed, would put you at a higher risk. And infection with HPV virus would put you at a high risk for cervical cancer. One warning sign that for either of these, cervical or uterine cancer, is abnormal bleeding. So that's something that you want to watch out for. If you're bleeding heavily in between periods, that is a sign something is going on. Next is testicular cancer for men, and ages 15 to 35 are the greatest risk. It is a young guy's cancer. The cause is really unknown. It's impacting top athletes. There's really no rhyme or reason. Studies that I have seen, really one of the only things that kind of can be a precursor to this is undescended testicles at birth, but even that isn't really clear cut as a cause. So they're not really sure why this happens. Obviously, if you have a family history and you have undescended testicles at birth, you want to definitely be vigilant about doing the monthly check, just self-exam, feeling for lumps, very similar to how females are checking for lumps in the breast. Just making sure to check that out at these young ages between 15 and 35. So how do we deal with basically the cancer crisis that we have? Again, this is a number 2 killer in the United States. Well, the first is obviously trying to prevent it before you would even get it. But the second thing you want to do is making sure that you're screening as soon as possible. Just doing those self-exams, getting your yearly checkup, all of those things. So the prevention, is really a 2 ways. You want that prevention so you are kind of eliminating and moderating those things that put you at risk. And then also, sometimes we can't do anything because it's just genetic or whatever, making sure that you are getting checked up. So know your family history, avoid carcinogens, particularly your smoking, know the symptoms, practice self-exams, and get your checkups regularly. And we do have some high-tech tools to help detect cancer, like MRIs and CAT scans. As always, you do not need to write this in your notes, but just put in to refer to table 12.4, and it gives you a list of some of the top cancer sites and the screening procedures, such as mammograms for breast cancer, pap smears for cervical cancer, the colon cancer. We have the colonoscopy, sigmoidoscopy, and the fecal blood test. So just looking over that. And then for the prostate, doing the prostate specific antigen test, or the PSA test. So it tells you when you should be getting these and at what age, and this is just a good thing to look over prior to your test. And our last slide is on cancer treatments. So our most widely used, we've talked about in class today, really briefly, is basically surgery. And they call this field surgical oncology, which is surgery to remove tumors. So there's a whole specialty when you look at your doctors and surgeons just for this. And they would kind of come up with the treatment plan on how this is going to go. Next, we have chemotherapy, and this is the use of drugs to kill cancerous cells. The bad thing is it also kills good cells. So that's why there's so many side effects. And then we have our radiation therapy or radiotherapy, and this is using x-rays to kill cancerous cells. Some other options, we have what's called the gamma knife surgery, which is another type of radiation therapy, which is really high tech, where they have all these beams of radiation lasers pointed at the tumor, and so that's one option. We have gene therapy, immunotherapy, cancer fighting vaccines coming out, like our HPV vaccine is supposed to be really just pretty much eliminating cervical cancer in the future, which was one of the things we talked about with that video on Edpuzzle, if you got a chance to watch it. And lastly, there's a lot of promise in stem cell research for cancers, particularly leukemias and lymphomas. Okay, that's it for cancer. So next you need to do your diabetes slides.